case 2. Here we've got a cyst. At first glance, you'd think this is an epidermoid cyst, or an epidermal inclusion cyst, as pathologists like to call them sometimes, or as surgeons call them, a sebaceous cyst, which is not at all accurate because there's nothing sebaceous about these, as pathologists all know, I think. But in any case, whatever name you like, it looks like a keratin-filled benign cyst. So it would be good for an epidermoid cyst, but there's something a little extra and special here. And that's when we look at the epithelial lining of the cyst, it does look like epidermis, like you'd see in an epidermoid cyst, epidermal inclusion cyst, or follicular infundibular cyst, if you like that name. But the lining is papillomatous. It has kind of finger-shaped projections that stick up into the lumen. It's kind of got a warty look to it. There's also parakeratosis, that kind of rounded up parakeratosis that we often see in the setting of HPV virus, like in Verrucous vulgaris. And you can even see some cells that are larger in the granular layer here, that are larger and have kind of pale cytoplasm and enlarged nuclei. And these cells, to my eye, resemble chondrocytes. So this looks like an epidermoid cyst, except the surface lining has the changes of a Verrucous vulgaris. So this is called a Verrucous cyst, and it's basically got similar features to epidermoid cyst, but also with lining changes that look a lot like Verrucous vulgaris. And these are due to HPV infection. And there are various, it's uncertain what exact types of HPV are found in these. Not a lot of studies have been done on those, but occasional rare case reports have identified the subtype. But in any case, it looks like a wart, but turned into a cyst, basically. So you'll get hypergranulosis, papillomatosis, parakeratosis, and sometimes you'll see chondrocytes. And the lining tends to look like epidermoid cyst or follicular infundibular cyst, but sometimes it can also look like pilar cyst or tricholemmal cyst, whichever name you prefer for that entity. So you can have kind of a variability in the cyst lining, but it's benign and it has warty changes. And this is, I think, a very nice example of a verrucous cyst. So a benign verrucous cyst, just a kind of curiosity to know about. I only rarely encounter these in my practice. I'd say less than once a year probably. Or if I'm seeing them more often than that, there must be very subtle and I'm not recognizing them. So just keep this in mind if you see an unusual looking cyst that looks kind of warty, verrucous cyst.